So first question was, it was asked in paper 3. Okay. So what are the advantages and disadvantages of robotic knee replacement? A straightforward question. Many of you can answer. It was about 3 marks, I guess. So we need at least 4 to 5 advantages and 4 to 5 disadvantages. Okay. So what is the advantage of robotic assisted orthoplasty? First is accurate planning, optimal selection of the implants, soft tissue release is less, so it is a minimally invasive surgery. Okay. Accurate alignment. So whatever alignment you can plan, you will get it. Okay. Precise bone cuts and accurate placement of implants. These are the one which we want to hear it. Okay. One is accurate pre-op planning. Then implant selection will be accurate. Whichever implant you want, you can select it. Less soft tissue release, less soft tissue release, accurate alignment, and you can try different alignment also. Functional alignment, kinematic alignment, reverse kinematic alignment, all those things can be tried. Precise bone cuts and accurate placements of implants. Okay. So what are the disadvantages? It's simple. First thing is this specific answers are very important. Limited long-term data. This is very important. Okay. So most of the knee replacements, robotic replacements have started about a decade now. So compared to the conventional, which has about 40 to 50 years of long-term data, with the robotic, we have a very limited long-term data. So this is one indication. Second thing is uh, limited implant choice. That means what? There is these robots are closed platforms. For example, if I'm using one company robot, I was supposed to use same company implant. There is no change of different company implant. So it is a closed platform. Okay. It has got a long increased surgical time. So increased surgical time indicates increased risk of infections and complications. Okay. Some of the robots require CT scan, so increased radiation exposure. Surgical time is higher as it has got a high learning curve, and also buying a robot is very high cost. Okay. Apart from this, one specific disadvantage I like to tell you is fracture, pin site fracture. When you're doing a robotic knee replacement, you place a pin that causes a pin site fracture. So that important finding you have to tell them. Okay. Pin site fracture, long limited long-term data, and high surgical time is higher and high learning curve with higher economical investment. These are very important disadvantages. Okay. So this question was asked for 3 marks, 3 to 4 disadvantages, 3 to 4 advantages. You should be precise, not writing full theory kind of answers. It should be an objective way of answering. Okay. So next question is enumerate the causes of AVN of the femoral head and classify AVN of the femur head. So the question is very simple. It is for 3 marks. You have to write the causes as well as classification. So how will you divide? This is a simple way. Okay. Traumatic, non-traumatic. Simple. Traumatic, we know femur head and neck fracture, right? Hip dislocations. And in pediatrics, it is SCFE. Okay. Anything which is involving the neck and the head, it is involved. So simple thing, right? Traumatic, it is head and neck fracture of the femur, hip dislocations, SCFE. What are the non-traumatic causes? You can write anything. Alcohol abuse, idiopathic, steroid use, sickle cell anemia. Okay. Other important non-traumatic systemic causes are SLE, post-organ transplantation because high use of steroids, radiation therapy, smoking, pregnancy. Okay, all those things will be there. So basically, I want you to remember as if you mention heading as traumatic and non-traumatic, it becomes very easy to remember and list it down. Yeah, this is a straightforward answer. Okay. So this question you should not, there's no hope that you miss this question. Okay. So then if the question is also about the etiopathogenesis, this is the etiology and this is the pathogenesis. What is the pathogenesis? It's a traumatic pathway, non-traumatic pathway. What happens? Any trauma will lead to vascular disruption, will lead to ischemia. Okay. Whereas non-traumatic pathway will lead to altered coagulation. Altered coagulation. Altered coagulation with either glucocorticoid drugs, chemotherapy, or hypercoagulation. Altered coagulation state will be there. This will lead to endothelial dysfunction. So endothelial dysfunction lead to thrombus formation, which in turn cause critical ischemia. Okay, understood. This is very simple. Any cause will lead to altered coagulation. Altered coagulation will cause endothelial dysfunction. Once there is endothelial dysfunction, there is a thrombus formation and there is a critical ischemia which leads to AVN. Remember, the question is asked for 3 to 5 marks. You need not to explain everything. This simple flowchart will give you enough marks. Okay, if you write pages together of writing this pathogenesis, you will get instead of 3, you will get 3.5 extra. But how much time you're going to lose? So that's very important. Answer should be to the point. Okay. Causes, etopathogenesis, classification. Classification, whenever they ask you classification, better to put it in a table form. Okay, table form is very important. We have modified Fickat. This is the one we should supposed to answer. Okay. Stage 1, stage 2, 3, and 4. Stage 1, stage 4, it is easy to remember. Stage 1 is normal. Okay, plain radiograph. Stage 4 is complete collapse. Osteoarthritic changes. OA changes will be there. Okay. So normal radiograph, completely osteoarthritic changes will be there. Stage 4. Now the question comes how to remember this 3. Okay. How to remember 2A, 2A, 2B, 3. The question is here the only one thing you have to remember. Crescent. Where is the word crescent? Crescent fracture, crescent sign. Okay, where do you see? Crescent alphabet, if you see A, B, C, 3 alphabets are there. 1, 2, 3. Okay. Third stands for 3 letters stands for C. So in this, which is the third one? 1, 2, 3. So 3 is the crescent. Okay. This is how you remember. Crescent subchondral line or fracture. Subchondral line or fracture is seen in 2B. Above it will be sclerosis, below it will be sequestrum. Simple it is. Crescent sign indicates what? Crescent indicates there is a subchondral collapse. Okay, there's a fracture which has got subchondral collapse. One second, if I have that clinical photo, yeah, this is the one I'll want to show you. If you see this side, you'll remember. Okay, you're seeing this subchondral bone. This is a subchondral bone. This is a cartilage. There's a collapse. Okay, once this is a collapse, this part will get separated. Okay, that is called sequestrum. So how do you remember? Simple. How do you remember? 1, 2, 3, 4, 5. Okay. 3 is what? 3 stands for crescent. Crescent is subchondral fracture. Anything below will be sequestrum or above will be sclerosis. Simple it is. Stage 1 normal, stage 4 OA changes, 2A, 2B, 2C. Now treatment also symptoms. Up to stage 1, stage 2A, it is salvage of head. Either you do core compression or you do vascular pedicle graft, whatever it is, you try to save the head. Anything beyond 2B is THR. Okay, so this middle part is very important. From 3 onwards, it is THR. So what is the key thing to remember in Fickat Arlet when you're revising? Just revise only where C comes. C comes for 2B because in 1, 2, 3, 3 is 2 comes to be 2A. 3 stands for letter C. C is crescent. So that's how you remember. It's very easy. Okay, fine. Any doubts, you can put it down. So this is how a crescent appears. If you see this diagram, you'll remember this is crescent. That means crescent is what? Subchondral. This is subchondral. Anything below cartilage is subchondral bone. This bone will be fractured. Okay, that happens in 2B. So you cannot save this head, right? So that's very important. Okay.